Welcome to the Brushing Up on Mouth Care Education Series. In this series, we are focusing on personal daily mouth care for older adults. Many older adults experience a decline in physical and mental health as they age. This often leaves them dependent on others to assist them with their personal care needs. There are 5 learning modules in this series that relate to the various aspects of providing daily mouth care. This is module number 2, Brushing Techniques and Oral Health Products. In this session, we will review toothbrushes, toothpaste, and brushing technique, floss, floss alternatives, and flossing technique, mouth rinses, denture care products and cleaning technique, other oral conditions and products. Please note that this educational video was developed for use in long-term care, and therefore the term resident is used throughout to describe the recipient of care. However, this information is also valuable to those providing care in other settings, such as home care and acute care. In these instances, please take the term resident to mean client, patient, loved one, or whatever term best describes the person you are caring for. Introduction. Current statistics indicate that many Canadians are expected to live well into their 80s and 90s in the coming generation. Of particular importance to our education series is that more and more Canadians are aging with their natural teeth. We are already beginning to see the effects of this change. The number of older adults who have complete dentures has decreased. Those with all or some of their natural teeth intact are demonstrating new patterns of dental disease. For example, dental decay and gingivitis are known to increase in older adults who are frail and dependent. This presents a challenge for care providers who are responsible for ensuring that residents receive adequate daily oral care. Caring for natural teeth is much more complex than caring for dentures. Brushing another person's teeth is a very different experience than brushing your own teeth. When brushing your own teeth, you are getting feedback from within your own mouth, which lets you know how clean your mouth feels. Without this feedback, it can be difficult to determine how thorough your brushing has been. This lack of sensory feedback is often compounded if a resident has limited communication skills. Over the past several decades, there have been many developments in oral hygiene products and practices. When used effectively, these advances can help improve daily oral hygiene and reduce the incidence of dental diseases. Products such as antimicrobial rinses, fluoride, electric-powered toothbrushes, floss alternatives, and many others are commercially available. This education module provides an overview of some of these products. It also presents ideas on techniques that will assist care providers when doing mouth care. Toothbrushes. What is a toothbrush designed to do? Toothbrushes are designed to remove debris from the surface of a tooth. Toothbrushes date back to 1600 BC. Originally, they were twigs or sticks cut from tree branches. The ends of the branch were frayed by crushing the fibers to make bristles similar to the toothbrush bristles we see today. Modern toothbrushes are used in much the same way. They remove debris and plaque from the surfaces of teeth and gums. They also stimulate the gum tissue to keep it pink and healthy. There are many different kinds of toothbrushes. Bristles can be flat or crossed, hard or soft. Brushes can be manual or electric. The question is, which is the most effective at removing plaque? There are many scientific studies looking at the efficiency of toothbrushes, but there is little evidence to prove that one model of a manual brush is more effective than another. There is some evidence suggesting that, when used properly, certain electric toothbrushes can be more effective than a manual brush at removing plaque. To be effective, a toothbrush should be durable, flexible, easily manipulated, and easily cleaned. It should have a lightweight handle and strong bristles that are not too rigid. Most importantly, it should meet individual requirements. Not all toothbrushes are appropriate for all people. There are a number of influencing factors to consider when choosing an appropriate toothbrush for a resident. What is their ability to use a toothbrush effectively? Do they have a physical condition that will impact their ability to brush, such as a problem with mobility, manual dexterity, or vision? Are they motivated and willing to do their own care? It is always best to use a soft or ultra-soft toothbrush. The gums of older individuals are often tender and can bleed easily, especially if they are already showing signs of gingivitis. Softer toothbrush bristles are more effective in cleaning the area close to the gum line. This is the area where the gum meets the crown of the tooth. Soft bristles are gentler on the gum tissue and will reduce the chance of gum recession and toothbrush abrasion. The prolonged use of a brush with harder bristles can cause the tooth enamel and dentin on a tooth's root surface to wear away. This can cause the crown of the tooth to weaken, resulting in abrasion and sensitivity. It may be necessary to use a child-sized toothbrush for residents who have difficulty opening their mouths wide or have small mouths. Children's toothbrushes have smaller heads and smaller handles. Smaller handles can be good for residents with small hands. A collis curved brush is specially designed so that the bristles are curved. These curved bristles surround the tooth. This is meant to allow both the inside and outside surfaces of the teeth to be brushed at the same time. These brushes can be especially helpful for residents with limited dexterity or for care staff attempting to brush the teeth of a more resistant resident. Specialty grips can be custom made to meet the needs of individual residents. Some examples of specialty grips include a rubber bike handle. This provides a better grip for residents that don't have good manual control. A tennis ball. This is good for residents that cannot grasp the small handle of a regular toothbrush. Long-handled toothbrushes are also available for residents that cannot fully bend their arms. Suction toothbrushes attach to the suction machine and allow the care provider to brush a resident's teeth while the suction works to remove any debris or saliva as they brush. This type of brush is ideal for residents who have difficulty swallowing. An electric toothbrush is a good alternative to a manual brush, especially if the resident has physical limitations that affect their ability to brush. Electric toothbrushes should be used for at least 2 minutes. Many have built-in timers. There's no need to apply pressure on the gums or teeth when using an electric brush. It is designed to do the work for you. Technique is still important. If the bristles are not placed properly on the gum line, the gums can become irritated. It is important to read the directions before using an electric brush, as they are all designed slightly different. Some research has shown that electric toothbrushes can be more effective than manual brushes when used properly. There are a number of reasons for this. Oscillating, rotating technology can easily loosen and sweep away plaque. Electric toothbrushes have higher speeds and motions that cannot be reproduced using a manual brush. They have larger handles that can be good for some residents. In recent years, electric brushes have become lighter and more comfortable to use. Residents should have a toothbrush for their teeth and a different toothbrush or denture brush for their dentures. Toothbrushes should be replaced every 3 months unless the resident has been sick. A toothbrush should be replaced immediately following an illness to ensure that the resident is not re-exposed to the bacteria or virus associated with their illness. always replace a brush that looks worn or frayed. Brushing technique. Positioning. Care providers should practice proper positioning when attempting to brush a resident's teeth. Good positioning will minimize stress and strain on the care provider's back, neck, and joints. If the resident is sitting, the care provider should stand beside or slightly behind him or her. The arm is then wrapped around the resident's head, and the care provider can lean over slightly to see in the mouth. The care provider's hand is stabilized by resting it on the resident's chin. With this hand, the care provider will then gently pull the resident's lips open. Taking this position slightly behind the resident will provide better access to the resident's mouth than positioning beside or in front of the resident. However, if the care provider feels any stress or strain on their back, neck, or joints, they should change positions. If the resident is in a wheelchair, you may be able to tilt the chair back. If the resident is lying in bed, you can sit or stand beside their head. This allows for greater visibility and less strain on the back, neck, and joints. Standing beside or behind the resident may not be appropriate when caring for someone with dementia. This may impede their ability to see and anticipate what is happening. In this case, you would want to position yourself in front of the resident. Brushing. The effective removal of plaque depends more on the brushing technique than on the brush itself. There are many different methods of toothbrushing. The technique that is most widely accepted by dental professionals is a method that is meant to effectively remove plaque with minimal trauma to the teeth and gums. It is easy to learn and apply. Hold the toothbrush handle in the palm of your hand with your thumb against the handle. Make sure your thumb is close enough to the head of the toothbrush that you can manipulate it with control. Direct the bristles towards the resident's gums. Place the bristles partly on the gums and partly on the tooth surface. The brush should be at a 45-degree angle to the tooth. Gently vibrate the bristles and roll slowly, moving the bristles from the gums towards the top of the tooth. Slowly count to 10 as you do this procedure. Repeat these steps up to 5 more times in the same area. For the front teeth, position the brush on its end and place the narrow end of the brush head 45 degrees to the gums and teeth. Vibrate and roll as described previously. Brushing sequence is also important. This ensures that all areas of the teeth and gums are brushed. Start from the same place each time. A good starting place is the outside of the teeth in the upper molar region on the right side of the mouth. From here, move the brush around the mouth to the left side. Repeat on the inside of the upper teeth and on the inside and outside of the lower teeth. Brush strokes should constantly overlap the previously brushed area. If a resident is resistant to oral care, try to brush the areas that are harder to access first. For example, starting on the inside of the teeth. It is important to brush for approximately 2 minutes to effectively remove all the plaque. There are different methods you can use to time brushing. You can count to 10 on each stroke or use an egg timer. Some electric toothbrushes have built-in timers. A more creative way to time toothbrushing would be to listen to a song while brushing. Listening to one of the residents' favorite songs may make this process more enjoyable for them. The timing of brushing is also important. Brushing after a meal is ideal to remove food debris. Brushing before bed is encouraged because any bacteria and plaque left on the teeth will thrive during sleep. The mouth tends to be drier during sleep, so the teeth are not protected by saliva's natural cleansing ability. The longer bacteria remains undisturbed on the teeth, the more damage it can cause. The recommendation to brush the teeth at least once a day should be considered the absolute minimum. If it is possible to brush more often, such as after a meal, then this should be done. When teeth are brushed only once a day, due to a resident's resistant behavior or significant disability, it is extremely important that plaque removal is thorough. Plaque houses the bacteria that cause dental disease. Removal of plaque is the only way to minimize the risk of dental disease. In certain situations, such as when someone is extremely debilitated or in the later stages of palliative care, brushing may not be the best choice. In these situations, brush aids are available to assist in the removal of plaque. The care provider can wrap gauze around their finger and wipe plaque from the tooth surface. Baby finger cots can also be used on the gums. These are rubber finger cots that have an irregular surface to allow stimulation of the gums. These options should not be used for people who are demonstrating resistant behavior, as there is a risk that the care provider's fingers could be bitten. Toothettes, mouth swabs, and oral cleansing swabs are all in the same family of products. They are commonly used in hospitals and long-term care facilities in place of a toothbrush. These products should be used with caution, as they have been shown to have limited cleaning abilities, especially for removing plaque from the teeth. They are most appropriate in applying moisture to the mouth or for removing large particles of food debris that may be pocketed. A toothbrush is the safest and most effective way to clean and stimulate the oral cavity. Glycerin swabs are no longer recommended due to their high acidic levels or low pH. For example, lemon glycerin swabs have a very low pH. Any product with low pH can increase the risk for dental decay, enamel erosion, and can irritate the mucosal tissues within the oral cavity. Swabs without glycerin or lemon are available and provide a better alternative for moisturizing the mouth. Toothpaste. The abrasives and cleansers in toothpaste help to remove plaque and debris from tooth surfaces. Toothpaste can be used for preventive, therapeutic, or cosmetic purposes. There are many different kinds of toothpaste available to address specific needs. For example, there are toothpaste designed for people with sensitive teeth, stained teeth, and higher rates of dental decay. All toothpastes have basic components. Most toothpastes today contain detergents, polishing agents, binders or thickeners, flavoring, water, therapeutic agents such as fluoride, preservatives, sweeteners, coloring agents, and humectants. Humectants are used to prevent the toothpaste from hardening when exposed to the air. Therapeutic ingredients like fluoride are important. Fluoride helps to prevent tooth decay. Because older adults experience higher rates of dental decay, it is important that residents' toothpaste contains some type of fluoride. Some whitening toothpastes have either a chemical additive or an abrasive component added to the paste. Abrasives can wear enamel from the teeth and dentin from the roots. Gel toothpaste may be a better alternative when tooth wear is a concern. Commercial toothpaste should not be used with residents who have difficulty spitting or swallowing. For these residents, plaque and debris can still be removed by brushing. Brush gently with water alone or dip the toothbrush in mouth rinse before brushing. Sometimes toothpaste can cause a burning sensation on the oral tissues. If a resident complains of burning mouth, you may consider changing the brand or type of toothpaste being used. Using too much toothpaste can cause choking or gagging. When toothpaste is used, only a pea-size amount should be applied to the toothbrush. Floss and alternatives. Flossing is important because it cleans plaque and food debris from between the teeth where toothbrushing cannot reach. Floss is the only tool required for flossing. There are a variety of flosses available commercially. If the spaces between the teeth are wide, something as simple as a fine knitting yarn can be used for flossing. Here are some guidelines for effective flossing. When you are flossing a resident's teeth, remember to use good positioning so that your back, neck, and joints are comfortable and you have a clear view of the mouth. Take about 18 inches of floss and wind it around the middle finger of each hand, with about 5 inches between your hands. Pinch your thumb and index fingers together on the floss and leave about an inch between your two hands. Glide the floss between the resident's teeth. Hold the floss snug to the tooth and make a C shape around the tooth. Slide the floss under the gums. Use an up and down motion along the side of each tooth. Pull the floss out from between the teeth. With a clean section of floss, move to the next tooth. If the floss shreds, you may want to use a waxed floss, which will slide between the teeth more easily. Flossing technique will improve with practice. Gums may bleed at first, but with regular flossing and brushing along the gum line, this should stop within a few weeks. Whenever possible, a resident should be encouraged to floss their own teeth. For residents with limited motor skills, floss can be tied in a knot to make a circle and looped around the resident's fingers. This may make it easier for them to floss without assistance. If limitations prevent a resident's teeth from being flossed the traditional way, there are aids such as interdental brushes, interdental tips, floss handles, and dental toothpicks. Interdental brushes have large handles which make them easier for residents to hold. They have small heads that fit between the teeth and are cylinder in shape. They range from small, medium, or large in diameter. These brushes can make it easier to access in between the back teeth to keep them clean. Brush tips are usually disposable, while the handles can be used for years. These handles should be rinsed after each use. There are some interdental brushes that are completely disposable, meaning when the brush tip is worn, the whole brush, including the handle, is disposed of. Interdental brushes can be dipped in mouth rinse or have toothpaste added to help clean between the teeth. These brushes should be maintained the same as a regular toothbrush. Interdental tips are usually made of rubber or plastic. They are usually attached to the end of a toothbrush handle. The soft, pliable rubber tip is usually preferred because it fits between the teeth more easily than the plastic tip and is gentler on the gums. Interdental tips are used to remove plaque and debris from in between the teeth and below the gums. They are also used to stimulate the gums. Proper use of an interdental tip involves tracing the tip along the gum line and in between the teeth. Be sure to rinse off the tip after use. Dental toothpicks have been used for many years, and the residents may still like to use this product. Typical wooden toothpicks are good for removing debris, but specially designed toothpicks for dental use are also available. These toothpicks, called interdental cleaners, go by many different names such as dental wood sticks, stimulants, dental picks, soft picks, or go-betweens. They are usually made of wood such as birch, which helps reduce splintering. Some dental picks also have sweeteners or flavors added such as xylitol or mint. They are about 2 inches long. The shape is designed to allow them to fit into the spaces between teeth. To use an interdental pick, push the pick gently between the teeth and rub it up against the sides of the teeth to remove food debris and plaque. It is important to do this gently to avoid trauma to the gums. Picks should be discarded if they show signs of breaking down or splintering. Floss handles come in different shapes and sizes. They can be used with residents that have limited dexterity and can be used with only one hand. All have some type of handle with floss attached. There are floss handles where only the floss is removed and discarded after use. The handle should then be rinsed thoroughly. Disposable floss handles are also available. These should be discarded once the floss becomes broken or frayed. This often occurs after one use. A handle may allow some residents who could not normally floss on their own to floss more easily. Also, when using a floss handle, the care provider does not have to place their fingers in between the resident's teeth. Proper technique for using a floss handle involves placing the floss in between two teeth on the biting surface and gently pushing the floss into the space between the teeth. Once inserted, pull the floss towards the side of one tooth and rub up and down to remove any debris on the surface of that tooth. Then push the floss towards the opposite tooth and use the same technique to clean all surfaces between the two teeth. Move to the next tooth and repeat for all surfaces. Mouth rinse. Mouth rinses can be a good addition to brushing and flossing to maintain a healthy mouth. Some provide benefits that go beyond just freshening the breath. Rinses can be therapeutic depending on the ingredients used. Some ingredients that can benefit the residents are oxygenating agents that cleanse the mouth, astringent agents that shrink tissues when they are inflamed, anodyne ingredients that reduce oral pain, buffering agents that reduce acidity in the mouth, deodorizers that neutralize odors in the mouth, antimicrobial agents that kill or reduce bacteria in the mouth, antiseptic agents that inhibit the growth of bacteria in the mouth, fluoride that helps prevent tooth decay. Commercial mouth rinses contain a significant amount of water, but some also contain alcohol. Alcohol is used to increase the solubility of the active ingredients. However, alcohol can dry out the gum tissue. Mouth rinses that contain alcohol should be avoided if the resident has dry mouth or is a recovering alcoholic. Non-alcoholic rinses are available. Natural mouth rinses containing aloe vera or chamomile can help reduce mouth sensitivities. Here are some guidelines for using mouth rinses. Have the resident take a small amount of mouth rinse into their mouth. Ask them to close their lips with teeth slightly apart. Encourage them to force the liquid through the teeth and swish the liquid back and forth between the teeth and all around the mouth for 30 to 60 seconds. Then have them spit the mouth rinse out into the sink or a kidney basin. Do not allow the resident to swallow the mouth rinse. Make sure to read the manufacturer's instructions for proper frequency and length of time to rinse. Residents should use mouth rinses only if they have the ability to swish and spit properly. Fluoride rinses are an important addition to regular oral care, especially if the resident is prone to tooth decay. There are still some old remedies that can be used as alternatives to commercial mouth rinses. For example, a 1-to-1 mixture of hydrogen peroxide and saline, or club soda, a mixture of a half teaspoon salt and a half teaspoon baking soda in 1 cup of water. Denture care. Proper denture care is important for maintaining dentures, preventing sores, and limiting the amount of bacteria in the mouth. Dentures are made of acrylic. Acrylic is a porous material that can be easily scratched and damaged. The acrylic denture material does not have germ-fighting properties. This allows bacteria to reproduce on the surface of the denture, which can cause odors, sores, and irritations under the dentures. It is important to take the proper steps to clean and maintain a resident's denture. The denture should be cleaned at least once a day and checked for any broken or worn parts. A denture brush or a toothbrush used only to clean the denture will be required for proper cleaning. Denture brushes have very soft bristles and have been designed to help clean all surfaces of the denture. Here are some guidelines for proper denture cleaning. Always clean dentures over the sink. Line the sink with a wet face cloth or fill the sink 1/4 full of water. This will provide a buffer to prevent damage if the dentures are dropped while cleaning. Remove the dentures from the resident's mouth. To remove the dentures, place your finger at the back of the mouth and loosen the dentures by pulling them down from the roof of the mouth or pulling them up from the floor of the mouth. Hold the denture firmly between the thumb and forefinger of your non-dominant hand. Never hold a denture, especially a partial, cupped in your hand. This increases the chance of dropping the denture and could bend or break a partial. Rinse the denture to remove any loose debris and saliva. Remove any denture adhesive material that remains on the denture and thoroughly brush all surfaces of the denture. Brush the denture with liquid soap or a foam denture cleaning product. Never brush a denture with toothpaste. Toothpaste is abrasive and will scratch the denture surface. A scratched denture is more likely to collect bacteria. Brush the denture for at least 90 seconds and rinse thoroughly. Once cleaned and rinsed, dentures can be soaked. Dentures should be soaked at least once a day for a minimum of 30 minutes in a mixture of 1 teaspoon bleach and 1 cup of water, or denture cleaning solution. Soaking will help to remove any hard tartar and debris. Soaking dentures can also kill 99.9% of the bacteria that builds up on the resident's dentures. Doing a quick brushing without soaking the dentures may not provide the disinfectant they require. Residents should be encouraged to remove their dentures at night to allow the gum tissues to heal. If dentures are removed at night, clean them thoroughly before placing them in a soaking solution. Remember, you'll want to put the clean denture back into a clean mouth. Brush the resident's mouth with a soft toothbrush to remove any debris and to stimulate the gum tissues. There are many commercial products available for denture cleaning, ranging from natural soaking solutions to ultrasonic machines. There are new products on the market that can help reduce scratches and damage during cleaning. These products are usually foam gels with antibacterial agents, which kill odor causing bacteria and microclean without scratching. Denture comfort and adhesives. Make sure that the dentures are moist before placing them back in the resident's mouth. This will help reduce irritation to the tissues. If a resident typically has a dry mouth, products such as water-soluble lubricants can be placed under the denture to help make it more comfortable. Using a denture adhesive may help prevent irritation caused by loose-fitting dentures. But dentures that fit properly should not require adhesives. The natural suction between the denture and the roof of the mouth will be enough to hold them in place. Denture adhesives should not be used to compensate for an ill-fitting denture. A denturist or a dentist should be consulted to adjust the dentures so they fit properly. Dentures can be relined to help with the fit. Most denture wearers should not need adhesives, but some feel more comfortable and secure when using it. Denture adhesives come in 3 forms: paste, powder, or wafers. Denture paste comes in a tube and is squeezed right onto the denture. It comes in a variety of flavors and strengths. To properly apply paste to dentures, clean dentures thoroughly and then follow the instructions on the package for applying the paste. Paste can leave an unpleasant residue in the mouth when the denture is removed. To remove excess paste, use a slightly rough face cloth to wipe the remaining paste from the mouth, or have the resident drink carbonated soda, which will dissolve the paste. Powdered adhesives change the bite less than pastes. Powders are also easier to clean off the dentures than paste. To use a powdered adhesive, clean and rinse the denture. Shake powder onto the denture and place the denture into the resident's mouth. Denture wafers are cut to fit the shape of the denture and work better if the denture fits more tightly to begin with. Place the strips in the denture and seat properly in the mouth. The saliva will help adhere the wafer to the gum tissue. Other conditions and products. Dry mouth. Xerostomia is a condition that causes a lack of saliva in the mouth, resulting in dry mouth. This can cause oral disease and discomfort. Saliva is necessary to maintain the health of the teeth and gums. It protects, lubricates, and cleanses the mouth and aids in disease resistance. Decreased saliva flow can be caused by medications, illness, chronic diseases such as diabetes and hypothyroidism, or from cancer therapy. Residents with a dry mouth may find that their tongue sticks to their palate, and they may have trouble speaking, chewing food, or swallowing. They will be thirsty and will probably lick their lips frequently and complain of a burning or sore mouth. Having a dry mouth can cause plaque and tartar to accumulate in the mouth. This increases the risk of dental decay, particularly along the gum line. Some residents will complain that their dentures hurt or do not fit properly. Residents with dry mouth can even stop eating because of discomfort when chewing or trying to swallow food. They may need large amounts of water to help moisten the food and move it down their throat. There are many ways to help residents with dry mouth, such as placing a humidifier in their room, using toothpaste and rinses designed to treat dry mouth, and using saliva substitutes and lip lubricants. Saliva substitutes are products that contain physical and chemical properties similar to natural saliva. These saliva substitutes can be applied throughout the entire mouth as often as needed for comfort. Saliva substitutes provide long-lasting lubrication that soothes and helps relieve dry mouth. They can help reduce burning and minor irritations and help with swallowing. Most saliva substitutes are naturally sweetened with xylitol. Some examples of commercial products are Oral Balance, Bio Extra, Xerostome, Moisture, Mouth Coat, OptiMoist, and Xerolube. Lip lubricants contain lipid hydrophobic bases that help prevent moisture loss and softens the skin. Dry lips can be painful and embarrassing. Lips can become dry and cracked, especially in residents that have xerostoma. Dry, cracked lips are also common in residents who are dehydrated, are on multiple medications, or have nutritional deficiencies. It is important to keep the lips moist to allow comfort when eating and communicating. Apply lip lubricants generally, as often as needed to the lip area. Fluoride products. Fluoride products are used to prevent dental decay. They are indicated for people with natural teeth who have a history of dental decay, a high number of fillings, and/or a dry mouth. Although fluoride products are becoming more common when caring for older adults, they are typically prescribed or recommended by a dental professional or primary health care provider. The frequency of applying these products varies depending on the situation. Fluoride varnish is painted onto the teeth. If used properly, it is safe, cost-effective, and easy to apply. It takes less than 2 minutes to apply and adheres to the teeth even in the presence of saliva. Fluoride is slowly released over time to help remineralize the tooth surfaces. Residents should not eat or drink for approximately 30 minutes following the application of varnish and should wait until the next day to brush. Fluoride gels and fluoride rinses are available at the pharmacy over the counter. They are also used as a medication to prevent tooth decay and strengthen tooth enamel. These products should be used as directed or prescribed by a dental professional. Fluoride should be used immediately after brushing and flossing and just before bedtime. It is important not to eat, drink, or rinse for 30 minutes after using a topical fluoride. This allows the fluoride to adhere to the teeth. Any residue left in the mouth after fluoride rinsing or application should be spit out or expectorated. When residents are unable to spit effectively, fluoride must be used with caution. Cold sores. Cold sores are very common for many people and are characterized by small red blisters on the lips. The herpes simplex type 1 virus causes cold sores. This virus is very common and highly contagious. After the initial outbreak, these blisters can occur frequently and there is no cure. There are many over-the-counter treatments available. Common over-the-counter medications are Abreva and Silactin. These products should contain docosahexaenol or benzyl alcohol and are available in gels or creams. For the best results, use these products as soon as there is a tingling sensation on the lips. This usually indicates a cold sore is starting to develop. Directions for use. Wash your hands and the resident's hands, lips, and face with soap and water and dry with a clean towel. Apply the cold sore treatment directly to the cold sore with a cotton swab. Discourage the resident from licking their lips. Reapply as necessary up to 5 times per day. Symptoms can last up to 14 days. If a cold sore lasts more than 14 days, a physician or dentist should be consulted to prescribe antiviral medication. Beware of any eye irritations. This virus may spread to the eyes and is one of the primary causes of blindness. Canker sores. Canker sores are a type of herpetic lesion. They are also known as aphthous ulcers and are the most common type of mouth ulcer. Canker sores are painful and highly contagious. They can be passed on from one person to another via kissing. They tend to heal on their own within 14 days. If a canker sore lasts longer than 14 days, or if the resident has a fever, a physician or dentist should be consulted. These small painful sores are caused by a variety of factors, including injury to the mouth, stress, unhealthy diet, and medical conditions. Some medications, as well as nicotine gum, can cause mouth sores. Switching to nicotine spray or patches can eliminate this issue. It is important to avoid acidic foods when a canker sore is present. Treatment of canker sores depends on the type of canker sore and severity. It is important to try to determine what triggered the outbreak, as prevention is often the best treatment. There are no known cures, but there are different remedies and medications to help relieve the symptoms associated with canker sores. Remedies include saltwater rinses. Mix 1 teaspoon salt to 1 cup of warm water. Swish the solution around the mouth as you would a mouth rinse and spit out. Half a teaspoon of baking soda mixed with water until it makes a thick paste. Use this paste to cover the canker sore. Hydrogen peroxide can be mixed 1:1 with water. This solution can be applied to the canker sore using a cotton swab. Milk of magnesia can aid in the healing process and reduce pain associated with canker sores. Apply it directly to the sore 3 to 4 times a day. There are many over-the-counter oral care products available to help relieve the symptoms of canker sores and speed up the healing process. These products include gels, pastes, and rinses. Use these products as directed. In severe cases, oral medications can be prescribed by a dentist or physician. Mouth props are a valuable tool when working with a resident who is resistant to oral care. Mouth props can assist care providers in opening a resident's mouth and in keeping the resident's mouth open while they complete the resident's mouth care. Residents can gently bite on the white spongy mouth prop to help relax the muscles of the jaw while oral care is being done. It is sometimes hard to get the mouth prop into the mouth if the resident is clenching and resisting care. Because the prop is soft, it can be wedged in between the front teeth in the flat position and then turned to assist with opening. The prop should rest between the back teeth and not on the front teeth. The teeth should be positioned on the ridges. When the prop is resting on the left side of the mouth, care can be performed on the right side of the mouth, and vice versa. Care providers can also dip the prop in applesauce or jelly to help with inserting. The handle of another toothbrush can be used in place of a mouth prop if one is not available. This is called the two-toothbrush technique. Tongue cleaners. The tongue is often overlooked when brushing. However, the tongue and cheek tissues can accumulate bacteria on the surface. Both the tongue and the cheeks should be brushed during daily oral care. Commercial tongue cleaners are also available. Depending on the cleaner, there is often a plastic edge used to scrape buildup and debris off the tongue. Sometimes there is also an edge with bristles to brush the inside of the cheeks and the top of the tongue. Some toothbrushes now have tongue cleaners on the opposite side of the toothbrush head. Conclusion. There are many oral health products available today that serve many different purposes. The best way to determine whether or not to use a particular product with a resident is to look at their physical abilities and what their specific oral care needs are. If they have physical limitations, specialty toothbrushes are available with many different properties, for example, longer handles and smaller heads. Toothbrush handles can be adapted by adding bicycle handles or tennis balls to the ends of the toothbrush to help with limited dexterity or mobility. Electric toothbrushes may help residents with limited strength. Toothpaste do not have to be used if there are concerns with swallowing or spitting. Use water instead. Mouth rinses can be a good addition to oral care, but alcoholic rinses should be avoided. For all mouth products, remember to look at the ingredients to see if they are appropriate for the resident and follow the manufacturer's directions.
Let's test your knowledge. When brushing the teeth of a healthy older resident, it's best to use A. Oral swabs, B. Soft toothbrush, C. Gauze wrapped around your finger, or D. Mouth rinse. Don't brush at all.
The answer is B. Soft toothbrush. Oral swabs and gauze are helpful in removing pocketed food from the mouth, but the bristles of a soft toothbrush are better for removing plaque and stimulating gum tissues.
Ideally, brushing natural teeth should take at least A. 30 seconds, B. 1 minute, C. 2 minutes, or D. 5 minutes. The answer is C. 2 minutes. If a resident is able to cooperate fully with mouth care, accessing all of the surfaces of natural teeth with the brush should be achievable within 2 minutes or so. If a resident has difficulty, or if it is challenging to position a resident for easy access, it will take longer. The important thing is to ensure that all of the tooth surfaces are brushed so that plaque can be removed. Proper denture care includes A. Soaking the denture in cleaning solution for at least 30 minutes, B. Soaking the denture in plain water, C. Brushing dentures with toothpaste, or D. Brushing dentures with baking soda. The answer is A. Soaking the denture in a cleaning solution for at least 30 minutes. Which of the following statements is false? Decreased saliva flow, A. is a natural process of aging, B. is a side effect of medications, C. can cause problems with eating and digestion, D. contributes to halitosis, or bad breath. The answer is A. Decreased saliva flow is not a natural process of aging. In older adults, it is usually a side effect of medication.